Thanks for joining Kelly Kuhn PT. I'm going to give you an exercise today to help the foot, and this is an exercise that is good for anybody who's dealing with plantar fasciitis or any kind of ankle and foot pain. But I'll also use this exercise with knee patients, even hip and back patients, because I think mobility of the foot and the ability of the foot to move is really important to help not put as much stress on the knee and the hip and the back, even when we're doing either sports or even activities of daily living. So the way I explain it to patients is that the foot needs to be, if we think about it, it should be divided into three zones: the forefoot, the midfoot, and the rear foot. And those zones need to actually be able to move just a little bit separately of each other. They just have little bitty adjustment movements that help us to keep the foot kind of flat on the ground as we're moving and doing things. Sometimes though, for a lot of different reasons, we may kind of forget how to use those little bitty motions, and we'll just move the foot as a whole. And this sets us up for different movement patterns that might create some stress on other parts of the body. So a test for this is to see if you stand on one leg, do you kind of just stay straight over that whole foot, or does your hip kind of kick out? Do you have to lean a lot? Are you rolling to the outside of your foot, or is your foot kind of rolling back and forth? And if that's happening, this might be a good exercise for you. So what we're going to do, I'm going to back up a little bit so you can see my feet here, is I'm going to have you just turn your feet in together. The foot we're working on is the right foot, so that's the foot that's behind us, okay? And it's turned in, kind of pointing towards my left foot, and we're just going to do a little squat, just kind of bend down just a little bit and really push your right heel into the ground. I'm kind of sitting back into that just to get the foot moving. Okay, so it doesn't need to be a really deep squat, just a little bit will do. Some people will feel this in their foot. Some people won't feel anything, and that's okay because it's just movement, and we don't always feel movement, but that doesn't mean we don't want to warm it up. Some people may, if they're having some knee sensitivity, they may feel a little twinge in their knee. That's okay, as long as soon as you stop it walks off. That's normal, and that should get better with time. I think that this exercise can be done before we start to run, before we do any kind of exercise. I also tell someone who's dealing with foot and ankle pain, or maybe even knee pain, to try to do it every time they get out of a chair. So when our foot's been kind of sedentary for a while, we get up and we get it moving, and our brain really likes that, and that's a way we can use movement as medicine. You can also use it the second you start to feel the pain coming on. So if you've been feeling pretty good and you start to feel the foot hurting a little bit, stop and do a few, and you might be able to head off a little bit of the pain. And that's another way to use movement as medicine. So I hope you enjoyed this little exercise tip. And if you need any physical therapy or have pain and injury, please check out my telehealth online physical therapy site, kellykuhnpt.com. Thank you.